Hello there. So, your bundle of joy, your baby, has arrived with all the excitement and congratulations. And suddenly, you hear this thing called jaundice. What do you do? Mrs. Bridget Amega, a pediatric nurse, is on standby to help us learn more about this baby phase. Let's jump right in.
So jaundice is when the baby's eyes and skin turns yellow. Usually babies within the first 28 days of their life. Mostly you will see jaundice or you can pick jaundice up within the first 5 days of the baby's life. And there are several myths about it. People think that it is a normal childhood sickness. Some people also treat it with putting the baby in early morning sunlight. Some people put breast milk on it and a whole lot of things that are not proper, but they might have practiced it in the past. The truth of the matter is that jaundice is not a normal childhood sickness. It is quite common, but it is not normal. So jaundice has a lot of causes or several reasons for which a child will have jaundice. One of the reasons is a baby who is born preterm, sometimes infections, GCPD deficiency, and like I said, the normal changes the child is going through for having been detached from the mother. If the child is brought to the hospital on time, it is easy to treat. However, if the baby is not brought to the hospital on time, the consequences are lifelong. They are irreversible and they have a toll both on the baby and the entire family, especially within the first 7 days of the baby's life. If this period the child is brought to the hospital, it can be treated because around this time the jaundice levels have not crossed the child's brain. Because the problem is, as soon as it crosses the child's blood and goes into the brain, there can be very severe problems. So within this period, if the child is brought to the hospital on time, we do what we call phototherapy. We put this baby under a blue light and it clears the jaundice out of the baby's blood. So as the phototherapy is going on, the baby is also being breastfed consistently. There's a routine that we follow to make sure that the baby is taking enough breast milk and undergoing the phototherapy. In severe cases, we do what we call exchange blood transfusion. So the blood with the jaundice problem, to say so to speak, is taken out and the baby is given fresh blood. So the treatment of jaundice is dependent on how severe and how early the child is brought to the hospital. On the other hand, if the child is not brought on time and the jaundice crosses to the baby's brain, there can be severe consequences such as baby not being able to ever hold the neck. So the baby will not be able to have the neck sitting straight like this. Baby may have problems with seeing, with speaking, with hearing. All motor activities may be damaged. So one of the things we can prevent is we don't have to have cats, dogs playing around them, especially when you are pregnant, because they have these toxins that when we get exposed to, they affect the baby. Another thing is use of camphor in the clothes of the baby. It doesn't help because it also increases the child's risk of having jaundice. Also, when you are pregnant, it is advisable that you go to the ANC on time. And also, you are supposed to run all your routine lab tests, especially your GCPD.
New parents, I hope this information is helpful. Feel free to share your thoughts and experiences in the comment section and don't forget to like and share this video. This is Kids Sport, your go-to parenting series. Follow us on TikTok, Facebook, and YouTube. My name is Nayokom. Thank you for watching.